to be telling you about continuous bladder irrigations. The reason that we would use a continuous bladder irrigation is for maybe patients who have had recent bladder surgery or any surgery of the genitourinary system at all. So I'm going to tell you about some of the stuff that we have on the table right here. This is our 3-lumen catheter. This part of the catheter is used to inflate the balloon once the catheter is inserted to keep it in place. This little middle lumen is used for the drainage of urine, and then this lumen is actually where we do the irrigation. So we'll attach a tube up to this lumen, and this is sterile, you'll notice, so we have to remove this to let the irrigation go through. This is what our sterile irrigation solution is. We're using normal saline today. And then this is our IV tubing. So our IV tubing is also a sterile piece of equipment. And so this little spike here is sterile, so we want to make sure not to touch that, as well as this little piece that attaches to the lumen. So today I'm going to show you basically how to do it. So I'm going to demonstrate this on my patient here. I'm going to be your student nurse today. We have orders to irrigate your catheter. So can you tell me your name? Alright, and what's your date of birth? Alright, Miss Amelia. So before we irrigate your catheter, I'm going to press around on your abdomen to make sure that there's no pain, and I'm also going to make sure it's not distended, okay? So let me pull up your gown here. Alright, and do you have any pain right now with this palpation? Alright, and you don't look distended, which is good. If you are distended, it might mean that the catheter is clogged, basically. Okay? So we're going to go ahead and continue with irrigating your catheter. I'm going to put on some clean gloves because this is a clean technique. We do want to be as sterile as possible, though, because some of the equipment that we're using is already sterile, and such as the tubing that attaches to the IV solution, and also we want to make sure that no bacteria gets inside of your catheter.
And based on the results, it would just help us continue to provide care. We provide discharge instructions when we're done by the physician.
Alright, so we're going to take our normal saline and remove the cap. And we're going to take our IV tubing and make sure that our clamp is closed. And making sure that nothing touches the outside, we're going to spike our solution.
And also we will function properly, such as sponge and
alright. So we're going to hang it and fill the drip chamber.
So the infection control methods and the action form would be I'd wash my hands, look at my hand.
So we're going to prime the tubing now.
for our urine and straining.
Okay, and the tubing is primed, so we're going to close that back up. And then I'm just going to pick this up here to make sure it's not touching anything that's not still. So the next thing I'm going to do is I'm going to clean the top of the catheter so we have a nice sterile environment for the IV tubing to be attached to. Pull this back, remove the sterile cap, clean this for about 15 seconds. And then we're going to clean this portion because it was open to the air, just to be safe, for about 15 seconds. And then we're going to attach it. So then we would open the infusion up to, if we have certain specific orders, we're going to set the drop factor to that. Otherwise, we're going to start the infusion, and if there's any bright red flow of blood coming back through the tubing right here, we're going to increase the flow rate to make sure that that blood gets flushed out, and so it might be a light pink color once we're done with that, okay? So now we're going to go ahead and open the tubing. Alright, and that's how you do a continuous bladder irrigation, and next we're going to talk about an intermittent bladder irrigation.
Hi, my name's Abby, and I'm going to be showing you how we do intermittent bladder irrigation. So you just learned about continuous bladder irrigation, but your doctor may order intermittent bladder irrigation. The difference is, instead of hooking up this bag with tubing and everything on it, we're just going to be doing a bolus of solution. So we're going to get a sterile container and put some sterile solution in there. Grab your syringe and pull up about 30 to 50 cc's, whatever's on your orders. And then you're going to use the same aseptic technique with your alcohol swab. Take off the cap, clean that, clean your syringe, and you're just going to inject it at a slow, even pace into the lumen. And that's it.
So once you're done with the infusion, if you're just going to get rid of the irrigation supplies, then you would just detach them from the Foley catheter and put them in the trash. If you were also going to discontinue the Foley catheter, you would remove them, empty the contents as output, and then you would put those in the biohazard bin.